Okay, you're live.
All right. So, right, hello everybody. Before we get started, we respectfully acknowledge and give thanks to the Piscataway tribe, the indigenous people who are traditional owners of the lands of the Chesapeake Bay region. We also acknowledge all indigenous peoples, the traditional owners of the lands and the waters of the United States of America. All right, Katie.
Thanks everyone for joining us today as we celebrate Native American Heritage Month. We would like to take some time today to take you behind the scenes of research being conducted to serve Native American communities right here at the Johns Hopkins School of Nursing. And we're going to go around and I'll let everybody give their introductions, but joining us first up is Dr. Teresa Brockie. Do you want to introduce yourself?
Good afternoon. Thank you for joining us. My name is Teresa Brockie. I am a member of the White Clay Nation from Fort Belknap, Montana, and I am an assistant professor at Johns Hopkins School of Nursing.
And then we also have Ellie Decker.
Hi, everyone. I'm Ellie Decker, and I work with Dr. Barkey at the Johns Hopkins School of Nursing as a senior research program coordinator.
And Adrian Ricker.
Ami Dakota Dakota Wasukresh Kawaya Makiapie, Washichuya Adrian Ricker Makiapie, Wakchincha Wakpa Hechia Tahawahi. So hello, my relatives. Happy to see you. Name's Adrian Ricker, and I come from Poplar, Montana and the Fort Peck Assiniboine Sioux tribes. And I'm a research associate working on Dr. Brockie's Little Holy One project. And also I'm a PhD student at University of North Dakota in the Indigenous Health program.
And Deborah Wilson.
Hi, I'm Debbie. I'm a nurse, have been for 30 years. I'm now doing my PhD at Johns Hopkins. I'm faculty at the Ani Dakota College on the Fort Belknap Reservation, and I'm conducting research at the Fort Peck Reservation under the guidance of Dr. Brockie. And then last but not least, we should introduce Katie Nelson.
And I'm Katie. I am a hospice nurse by background and also a third year in the PhD program at the Johns Hopkins School of Nursing, conducting my dissertation at Fort Belknap. And so with that, we are going to cover a little bit about Little Holy One, which we have underway in Montana. We'll talk about the importance of instilling cultural values as a protective factor, parenting, mental health, and a bunch more. So let's kick off the discussion. The first question: what are some common misunderstandings about working with Native American communities, and what do you wish that people knew about the research that this team is doing? Adrian, you start.
Okay, I'll start. Okay, I was going to defer to Teresa. No. So when I think about research in Indian country, I've worked in research in various capacities on my reservation for the last 10 to 12 years. And I think what is often not understood is that our people are really open to being solution-based people on our own issues. Like, we definitely understand the disparities that exist because we live and exist in those disparities every single day. And there are a lot of things that happen in the community that happen naturally that are solution based. And so what research does is, when a researcher works inside the community and gets feedback from the community members, that's a really good way to guide the projects. And so community participatory based research, I believe, is the best way and really the only way to conduct research in Indian country, because there's just a wealth of knowledge that already exists in our people, and there's ways of knowing and doing that have worked for years. And really what we're seeing right now is just the systemic disintegration that has happened to our people as a result of colonization. And so the way back to health, I believe, is through our own understanding and knowledge base. So what I appreciate is that the Little Holy One project, which is also known as Wakayaja, which is Dakota for Little Holy One, what that is that's a culmination of years of participatory engaged practice from Dr. Brockie and many members of our community that provided feedback on what they believe is a solution to a problem that we knew was present in our society. And so this project took a lot of thought and prayer and consideration. And as an Indigenous researcher, Dr. Brockie really guided that process and allowed the community to guide the process and didn't rush into it. And so this project has just been a long time coming. And I like to assure my community that this is definitely from them, and you know, letting other researchers, especially that want to work inside Indian country, just really have to listen to the community you're serving and observe and give respect to that knowledge that exists inside that space. Dr. Brockie?
I will just add a couple of things, and then I think that we should really hear from Katie, Ellie, and Debbie, because Adrian, you and I have been in this space for a while, and they're new to the space. So if they can offer what they think are some of the common misunderstandings, I think that would be good. But I think when I think about Indigenous research, some of the misunderstandings, one is that they are hard to reach communities. And that's not my experience. They're very open. They want to look for, they want solutions, feasible, sustainable solutions based upon what their needs are. And then the other, I think, factor that is really misunderstood is that health disparities are race-based, and that's just not true. Health outcomes and life expectancies vary drastically based upon where people live. With that, I'm going to turn it over, starting with Ellie.
Thanks, Dr. Brockie. I think one thing in my 2.5 years now of working with Native American populations in Montana that I've learned is in line with what you just said, that communities are very open to research. They have solutions and they want to test and implement those solutions and use a research framework. I feel like in starting and being able to join this team, I've always been welcomed into communities, and people have always been eager to help with research projects and find solutions in ways that work best for their communities. And I've been really inspired by that perspective and that work. And I think it's different than kind of the message that we get sometimes, that these communities are very closed off, that they don't want research to happen there. So understanding that opposite perspective. And I think key to that is being part of a research team that's very focused on listening first. And that allows communities to tell you what their solutions are and what their problems are. I can turn it over to Katie next.
And I would just, sort of echo what Dr. Brockie and Ellie both have said, and maybe add that, there's a misunderstanding, not only that, they're hard to reach or, not willing to participate, but that talking about subjects related to mental health or suicide, or in my case, my work is around, serious illness and the end of life. And these are sort of taboo subjects. Native communities don't want to talk about it, or they can't talk about it. And I think that just sort of goes back to Ellie's point of just being part of a team that prioritizes listening first and really taking the time on the front end to really develop genuine relationships and go in with a respect and really just meet people on a human level, so that's something that it's not the researcher and the person on the other side just being badgered with questions, but that you really have an authentic relationship and you're both working towards a common goal, towards a solution that will work for them. Debbie, anything you want to add?
I think in terms of what you say about authenticity, because I think the thing that you've all been saying, that people are willing to listen and are interested in changes and promoting strengths in their communities. And the thing is when you go and you're going to make mistakes, and I think it's the big heart and the big spirit of the people that I've been working with that I have so much to learn. And I think also now living here and working here, I think there's also the humility as a researcher that you can read all you want about what colonization has done and the intergenerational trauma, but to actually see it for real and to have the humility to sometimes feel completely helpless in the face of it, and just know that in some ways I feel I'm going to learn more than I'm going to give, and that as a researcher, you think especially when you go somewhere like Hopkins, that you have so much knowledge, but I feel I'm learning more than I'm giving, and that's a real honor. So.
Thanks, everyone. I can jump in with the next question. What are some of the best practices for engaging in research with Native American communities? And Katie, do you want to start with that one?
Could you repeat the question, please, Ellie?
Yeah. The question is, what are some of the best practices for engaging in research with Native American communities?
I can kick us off, and then everyone else feel free to chime in. I think we've highlighted a lot of them, you know, going in and developing relationships right from the start. And Adrian did such a great job of giving sort of, you know, the prioritizing of community participatory research, where you have mutually beneficial relationships between researchers and the community, making sure that you're developing, you know, who are your stakeholders in the community that you're working with? Do you have equal, you know, voices from the community represented in all aspects of the research? I think, you know, me being a sort of a newbie on this call, new in this sort of space, I think it's been really humbling for me and such a great learning opportunity to sort of rethink what we mean by research, where I think, you know, being in the PhD program, there's a hard, you know, we're all about quantitative data. It's the numbers. It's what can we do with this number, and how can we get to the next thing, the next thing, the next thing. And I think, you know, working with Native communities, it forces you to sort of take a step back and take a sort of 360 view of things, and really just slow down and listen to people and develop relationships, and then let that drive the work that you're doing, and not necessarily like sort of putting whatever idea you have as far as a timeline aside and just letting it happen sort of naturally, versus being so like, we have to get this done. And obviously, you know, timelines are important, but making sure that you're really taking the time to develop the relationships first and then going from there.
I think that's a really great point, because that makes community-based participatory research real. You know, what you're saying, Ellie, is that you work on the timeline according to the people that you're working with, and that takes respect, it takes listening, it takes also being aware of realistic timelines that you might have with funding and everything. But I think that's also, you know, the fact that we're all here on this conversation together. It like might be my PhD and my research project, but I couldn't do it without all of you, and having the kind of conversations and discussions, and because that's what moves it forward in a way that's authentic and real, and with the community as number one, and what the community wants as number one. And I think one of the most powerful things too was Dr. Brockie, when you created that program, the program might not be, but it was a training for those of us that are non-Native, coming to work in Native communities with you and Larry Wetsit. And just those conversations just taught me so much, and taught me that it's okay to not know, and to learn and to ask. And it just created a foundation that has really, you know, it's created a foundation to move forward into the community. And I can't express enough how helpful that was.
I can jump in here too. Some of the things that I'm thinking of, in addition to like the importance of listening and developing relationships, are some more like straightforward, in some cases, logistical things like the importance of getting a tribal resolution and making sure that you have all the proper permissions in place before you start your research, and how important that is to respecting tribal sovereignty. Also thinking about like how you're going to collect your data, who's going to own the data, how you'll share permissions or how you'll get permission to share the data. All of those logistical pieces are really important to consider at the beginning of the project, but throughout your work, in addition to tribal resolutions, institutional review boards, which ones you need to go to get approval. I think just considering that at all phases is so important to making sure that you have a strong trusting relationship with the community, and are really considering all those factors.
And Adriann and Dr. Brockie, I was just wondering, since you've worked many more years than we have, I mean, was there anything you guys had to add from your perspective living there and us coming in?
Who wants to go first? You or me?
I'll go, Adriana.
Okay,
and then you go.
all right, I'll close it out.
So I think that when you think about best practices, certainly a collaborative model works best. You have to, engage with the community, with the leadership, and then working on a common solution that is identified by them. But some of what like Ellie has already said, and I really appreciate that information coming forth from Ellie. That means that we already know how to do the work, and so we're gonna make sure that we include all of those steps in our work going forward with other communities as well, but tribal authority, so that we get to make sure that we get a tribal resolution that authorizes our work. We make sure that we establish a tribal advisory board for each of our projects that helps guide and direct what we're doing. And then make sure that we have tribal, we expect that time into our, expect time on our timeline with regard to tribal IRBs. And then meaningful and tribal engagement, I think a couple of things: be respectful at all times, listen more than you speak. And these are coming right from the training that we developed, Debbie, for working with Native American communities. So listen more than you speak, especially if you're new to the community. Often only speak when you're asked to, especially in that community context. Engage early and often, go to where people are, don't expect them to come to you, work together and share power, give something back. Often food is always appreciated. And as Larry says, it's a ceremony to be able to share a meal with someone, and then close the loop. Report back, establish ongoing connections with the community, give them the data in meaningful forms, either through storytelling or however you present the data. They should have a good grasp and understanding of the data when you're done. And then be helpful outside of the research. And with that, Adriann, I'll turn it back to you.
All right, and I mean, I just echo all the sentiments that have already been said. What I can provide as a perspective of a community member who's been involved in research in various capacities in my community and seen it on different levels. One thing I can implore is that the practice of actually engaging with your community and really heeding the advice, because oftentimes I don't think researchers understand that the theory of what you're trying to do and the reality of what we're trying to do, there's a big bridge that you have to cross. And the people that are going to pull you across that bridge are your community members. And so when you employ those people inside those communities and you have an advisory board who's going to give you guidance on how you can make that theory come to life, then trust their word, because one thing that I know for sure as a community member, when we're trying these different interventions, we want it to work because, like I said, we're embedded in the community. our own family members, our own selves are impacted by these issues. And so anytime you have community members at the table, they really do believe in it and they want to be solution-based. And so I always tell researchers, like, they're never going to give you bad advice. They're always going to be thinking for what's going to be best for their community, because at the end of the day, when the research is done, those community members are still planted in those communities. And so they will never do anything that'll harm their community, nor themselves, nor you. So just really put a lot of trust and faith inside those people that you provide that opportunity to work and reflect what you're doing. And then, just anytime you can indigenize methodologies and really let the ways of knowing and doing that are indigenous, allow that to be the process in which you follow your research, because there's just different ways of how we're in relationship with one another, how we interact with one another, how stories evolve, and how information is transferred. So the more you understand that, and the more you know that, that'll help you navigate your research better. Even talking about the qualitative aspect or the timeline aspect, everything is never in a linear fashion. So the more you can understand those ways of knowing and doing, and the way you'll know that is by trusting your community members to allow you to teach you those things along the way.
So amazing responses. Maybe we could move now specifically to the Little Holy One project that you lead, Dr. Brockie. And maybe you could describe what is the goal of Little Holy One in the intervention, and what your role and Adrian's role is in this research project that you're doing at Fort Peck.
So thank you for allowing me to talk a little bit about our the project that we've been dreaming about for a long time as a collaborative effort. So together with the Assiniboine and Sioux tribes of Fort Peck, Montana, we have built a solid program of research. We are currently recruiting for our first cohort for Wakanyiza, a randomized control trial, which is a randomized control trial with an embedded single case experimental design that aims to, 1, reduce parental stress and trauma-related symptoms, 2, improve parenting, and 3, improve children's emotional and behavioral developmental outcomes to reduce future risk for substance use and suicide through a 12-component curriculum. All of this work is informed by the prior study that looked at the risk and protective factors for youth suicide. So some of the data informed the development of lessons for that 12-component curriculum. And I am the PI on the project, and I have a great team around me, and we have to do it together. We can't do it alone. So with that, I will pass it to Adriann.
All right, so my role with the Little Holy One project is I'm the site coordinator, which means I'm kind of tasked with trying to lift this off the ground and bringing life into the project by bringing the right team together. It's my goal to try to help give feedback to Ellie and Dr. Brockie and the vast research team that we work with on the practicality, becoming trained and well-versed in the evaluation and the intervention so that I may be of support in both areas. The way we do things around here, oftentimes, we have to get our hands dirty in there too. So I maybe play the role of an interventionist one day. The next cohort, I might be an evaluator. So I'm open to anything and everything. And I guess the main thing I have to do is just keep focused on the vision, and that'll help guide our steps along the way. So a lot of my role is just the capacity development and implementation of this project, which I'm really excited about. And then what I will do is I will pass it over to Ellie, and she'll share her role in our project.
Thanks, Adriann. My role is the Senior Research Program Coordinator for the Little Holy One project. And like Adriann said, and Teresa mentioned as well, it's kind of a variety of things that we get to do every day. But I think of my role as kind of the logistics and coordination and a bridge between our team based on the Fort Peck Reservation and our team at Johns Hopkins. And a lot of my role also centers on having our timelines in place and making sure we're following all the policies and procedures of things like our institutional review boards, our funders, and making sure we're moving the project forward. And then I also get to be really well versed in the research processes and procedures and all the different roles that our field team plays. So a lot of variety and really like the role.
Maybe does somebody want to tell us a little bit more about the intervention? What are you guys actually doing with the participants as part of the study?
I can share, and then Teresa, you can add in where I missed. So participants will be either assigned to the intervention group or the control group. The intervention group, as Teresa explained earlier, gets assigned the 12 curriculum lessons that we'll be working with them on a weekly basis. And there are lessons from the Family Spirit curriculum that have been adapted specifically for the Fort Peck tribes. There is lessons from CETA, which have been specifically adapted and tailored for the Fort Peck tribes. And then there are lessons, cultural lessons that were created by the Fort Peck tribe. So those are some of my favorite lessons. And those lessons are the ones done with the children and the parent. And the goal is to just, either introduce them to these cultural concepts and their broad concepts. We do recognize that we have multiple bands and 2 different tribes here. So the information is brought forth to the table by all the by a variety of cultural leaders that said these are some of the concepts that are consistent. And how that works is a lot of it is just relationality and how we connect individually with the client. So the intervention, we're trained on how to deliver the intervention, but what you can't be trained in is how you connect to that individual. And that's just something that's innate and cultural within us. So we spend a lot of time with the clients, getting to know them on a relational level. And then that invites us in to kind of facilitate these intervention lessons. And what's nice too, is it allows for a lot of feedback and engagement with the client. So we did pilot this summer. And some of the feedback we received from those that we piloted it with was that they just appreciated the opportunity to talk about some of these things that they don't talk about often. And even the difficult situations that we bring up in these conversations, they just appreciated the opportunity to provide and talk about it in a safe setting. So, and of course, we always provide food and take care of our relatives because that's what we're taught to do. And then our control lessons, there are 6 lessons for that. And our tribal advisory board did not believe that it's good to have a control group where they receive nothing. So that's not something, that's a cultural value that is instilled in us, that we don't believe that you have a set of people that don't get anything. So we have nutrition lessons that were developed that are fun and interactive for the parent and child. And so that is something we're doing with them for those that are assigned to the control group. Dr. Brockie, did I miss anything? Oops, you're on mute.
Yes, I see that now. I guess the sample size. So we're recruiting 120 parent-child dyads from the Head Start program. So both in Wolf Point and in Poplar on the Fort Peck Reservation. So the larger Head Start schools, we're recruiting over 2 years. We're delayed because, not obviously, but we're delayed because of COVID. So we're about a year behind, maybe a year and a half. We're really looking forward to recruiting our first cohort and seeing the results of the lessons. And I just wanted to name those cultural lessons, right? And for the 4 cultural lessons that we developed with the tribes is on enhancing tribal identity, which and one on enhancing communal mastery, which we renamed to strengthening family and community. And the third one is on smudging, And the fourth one is on healing historical and contemporary trauma. Again, those findings were all related to my dissertation study that found tribal identity and communal mastery protected for high-risk substance use. And then it also found that historical trauma or a family history of historical trauma was associated with both suicide ideation and attempts. And I think that was all. You provided a good overview, Adriann. So I'm not sure who's next.
That's awesome. Thanks for that. Just in case anybody was curious what the actual intervention was all about. So from this, Dr. Barkey, this is sort of for you and anybody else, feel free to chime in, but you've really, over the course of the last 10 years, you've expanded this team that you're working with. And so now you have people in Baltimore, you've got Ellie in Minnesota, Adrian and her team in Montana. How do you wrangle all these people together to work in different places to do this work that's really rooted in the community? Everybody wants to know.
I don't know about wrangling, but let's see. I do my best to pull us together, but I think that having a vision, a long-term vision, and sticking to that and reminding people, because when I remind people, I remind myself of what we want to do. And that is to develop interventions for reservation-based communities who are often our most, I don't want to say vulnerable, but there are no interventions available for them that work for them, that are made by them. So that's really what we want to do. And they're also often resource poor settings, if you will. So that's for me, that's my long-term commitment. And then it becomes our long-term commitment. But the other thing is, we spend so much time as researchers focusing on the negatives, the shortcomings, and we do a lot of blaming. And so we really want to flip the switch and focus on some of the strengths. And what in the short time that we've been doing this work, and it is a short time, we've identified strengths within the community that can be utilized to develop interventions that will then be able to address these sometimes long-standing issues. So I often, and the other thing I think, so I've spent a lot of time philosophizing with Larry and praying about solutions for our communities. And I think this is just part of it. You know, it starts happening when you align yourself in your work with the Creator. But we've done over 10 years. I believe we've developed a solid program at Fort Pat, and now we've just received funding from a private foundation and the NIH for working with the Ani and Dakota tribes on the Fort Belknap Reservation. And so a couple of things that we're doing there, one of them is on enhancing nursing capacity to understand and address the needs of Native American youth on the Fort Belknap Reservation, of course. And with that, we're training nurse leaders at Fort Belknap, but we're also doing a community assessment on risk and protection for suicide and suicide clusters. We're developing here at the School of Nursing a Native American health initiative. And hopefully part of that will include a fellowship on Native American health. We have the joint Fort Belknap community, Johns Hopkins School of Nursing, NARCH student tribal health leader and faculty development program. That is focused on eliminating health disparities in mental health. And an exciting thing that we're doing with that is we're developing culturally enhancing and adapting the existing Johns Hopkins School of Nursing psychiatric mental health certificate program for baccalaureate level nurses that work in Native American settings. We're also spending some time to develop a summer training program for high school students in nursing, public health, and STEM at Dakota College, which is one of the 32 nationwide tribal colleges in the United States. I think that's all I have for now, Katie. I'll turn it back to you.
I think what I'll add, if you can't tell by that long list of things, how we build community participatory based research is you have an awesome Indigenous research leader who constantly engages. So it is tireless work because you have to constantly engage with your networks at Fort Belknap, at Fort Peck, and you have to trust in the people that you have designated in those areas to facilitate the work that needs to be done. And so, and from our stance at the Fort Peck, what we try to do is we try to have a streamlined, open communication. And what enhances that communication is relationship building. So anytime we have the opportunity to connect on a personal level, we try to do that because it's those personal connections with each other that allows us to be more open. So, like with conflict resolution, if there are any conflicts or any frustrations on the team, we have a space where we feel open enough to be able to share those things. Or if we're concerned about anything, we have a space where that's an okay space to share it at, because we have taken opportunities to connect and engage on personal levels. And we also use opportunity that we have physically together, which has been far and few between in the last 2 years due to the current situation that we are all faced in. But we use that opportunity to connect over food. As Teresa says, Larry Wetzel, who's one of our main cultural mentors, says that food is ceremony. So we share a lot of food together. And we also engage in cultural practices that keep us grounded and keep us focused on what the bigger project is. So, and of course, Zoom and everything else helps, but.
That's awesome. All right, so
About those,
we also, sorry, Deb.
I was just saying, I think there is something very special about those in-person times, sharing food or being able to participate in more ceremonial events have been very special times for all of us. Zoom is great, but those times have been really something very special.
It's not the same. So we want to make sure we save some time. We're really, Debbie and I think I speak for both of us when I say that we're both so honored to get to do this, our dissertation work out in Montana. So Debbie, if you want to start and just tell us a little bit about the work that you're doing at Fort Peck for your dissertation.
Sure. So I've been lucky enough to be involved in adapting the 4 cultural components from Dr. Brockie's Little Holy One project, working with a tribal advisory board. We've been adapting those cultural components for the teachers of the children, so the Head Start teachers, because of recognizing that they come from the same community, that they've suffered the same intergenerational traumas and colonization as the children. So, and they work tirelessly to take care of the children and to educate them. So my research is working with looking at their stress and well-being and implementing the adapted version of these cultural components to help give them something to help to promote and strengthen their own well-being. COVID notwithstanding.
All right, thank you, Debbie. And what about you, Katie, when you share your dissertation with us?
So my dissertation, it will be at Fort Belknap, and with my background being in hospice, my project will be focused around exploring what are the perspectives and supportive care needs for those who are caring for people with serious illness, so things like cancer, heart disease, that we know are prevalent everywhere, to help support the public health nurses at Fort Belknap who are doing amazing work for everybody on the reservation, to provide care for people from birth up until death, but really get a better picture of what needs family caregivers have, what needs spiritual guides have, the tribal elders, and thinking about what sort of structures would be helpful to enhance the capacity on the reservation to continue providing the end of life care whatever that looks like for them. So I'm excited to get that started. And so Dr. Brockie, you went through, obviously we got a lot of work ahead of us. It never stops, but so this has been 10 years in the making. We're getting Little Holy One off the ground. Debbie and I are getting these dissertation projects off the ground. What have we, I guess this is really for everybody. What have we learned from doing this work? And where do we hope that things go next? And what impact are we hoping that this will have on Indian country? Big question, best for last.
Dr. Brockie, you gonna start first or?
Oh, I will. Let's see. I feel like we just started, but it's a lot of work. And I think just as important as building interventions for Native American communities is training Native American scholars. So we can, because we need to build a workforce. And so I think, so from our team, Adriann is currently in a PhD program. She can talk a little bit more about that. But that's gonna, change, I think, how we do our work at Fort Peck and help build the capacity to do the work from Fort Peck. So I think that's one thing. And, I see us as a group expanding to all of the reservations in Montana, and that means more training, more opportunities to build interventions. But we also have to, build a team, a solid team, and I feel like we're taking, those significant steps right now. And so, I mean, I'm invested. This is my career. It's not going to change. And so we just have to get more people trained. We have to build out a larger, not a stronger, but a larger team, because it's a lot of work. And then get support for our local teams. I think we need more capacity building at the community level to really do the work that we want to. So, all right, I'm going to pass it to you, Adriann.
Okay. So when I think about the last 10 years and how research has evolved, specifically on my reservation, that's all I can speak from is the impact research has had on my reservation and on me individually, is that I'm very fortunate that I have been blessed with many different opportunities related to the work that I've been involved, not only with Dr. Brockie, but with several projects with Dr. Beth Rink and Dr. Monica Stuez out of Montana State University. And what that has allowed me to do, it's allowed me to have more confidence in my understanding of research. So I believe our Dr. Warren always talks about the two-eyed way of seeing. So, like I live in both worlds and I'm able to translate and kind of cross over and enhance my understanding on both the Western methodology, but also understand my role as an Indigenous person and future researcher right now. And so what research can look like for us in the future and as it expands across Indian country is the most important thing is that you can make these stories, these voices that are not heard very much, they can be elevated, and you can empower more individuals to be at tables that I sit at now and be able to speak their truth and speak and represent their communities. And so I think that's what research has done. Whether or not people pursue the formal education process, they can still be actively involved in research in their communities and be advocates for research in their communities. and even speak up to their delegates in legislation, whether it be tribal, state, whatever. They can speak up about the issues that exist on the reservation and be solution based. So that's what research has done for me. I used to feel very helpless about the situations that I would see daily and experience daily, but I don't experience that hopelessness anymore. Part of that is because of my exposure to the research world and to understanding that there's ongoing solutions being explored. And I attribute most of it though to my cultural understanding. And I love how that's starting to intersect that cultural knowledge and understanding is being respected, because there's more Indigenous researchers and allies at the table that are advocating and saying, we already know the solutions, we just need the funding and capacity to move them forward. And I'm very appreciative of all those opportunities and for the work that we're doing collectively and other Indigenous researchers and allies are doing collectively across the United States and Canada to kind of move that momentum along. But I'll pass it on to Ellie.
Thanks, Adrian. So I would say my learning has been not 10 years, it's been almost 3 now in doing this work, getting to do this work. But I think a really key thing that I see for our team and that I'm really excited about is this building a pathway to STEM, nursing, and public health careers. As a non-Indigenous person, but someone who did come from a rural background with less diverse educational opportunities, thinking about how high school students can be exposed to these things and get really excited about different kinds of careers and opportunities is something that I'm really passionate about, and I think is so important to moving this work forward, is really developing that workforce and the next generation of passionate nurses and public health professionals and scientists as we move forward. So yeah, that's something I'm really excited about. I don't know if Katie or Debbie want to take a jump at this next.
I can. Oh.
Well, mine's not related. Because you guys are also articulate. First, I just wanted the fact of having Dr. Brockie as a cultural broker. I don't know if that's quite the right word. And also Adriann, just like popping in and just gaining wisdom from Adriann. I think being so lucky to have that, to strengthen the research and to have the confidence that you're moving in the right direction. And when you're not sure, being able to go to Dr. Brockie or even, just check in with Adriann has just been extraordinary. And just wanted to just say something following on from what you were saying, Ellie. Working as a faculty member at Dakota College, it's the most remote nursing college in the whole of the United States. And it has just been extraordinary. You come from somewhere like Hopkins, which is like the #1 nursing school, and you come and you're teaching students who have lived on a reservation and have suffered more in their young lifetimes than I will have ever experienced. And, because of my privilege and because of my connections, I've been able to bring in like professors from New Zealand and Australia, Aboriginal nurses and Maori nurses to speak with the students. And this, just seeing the empowerment and the strength that my role is creating the space for them to see that despite being in the most remote nursing school and maybe not have had the most great primary school or high school education because they haven't been able to go somewhere like Hopkins, that actually they have the life experience and that they know so much that will make them the most awesome nurses that I've ever seen. So that's been quite an honor, and the privilege of being able to help facilitate that is something that, again, is because Dr. Brockie was a cultural broker and helped set that up for me. So anyway, I'm rambling. So I pass it on to you, Katie, who's far more articulate.
No, I think that was very well said. And I think that's a sentiment that probably all of us share, is building up the workforce so that we have people that, Indigenous and non-Indigenous people alike, that are all well-trained and able to provide culturally safe care and education and research training for everybody in the future. I think what I'm most excited about moving forward, I feel like I'm coming full circle a little bit, because when I started as a hospice nurse in Minnesota, where I'm originally from, we would have Native people from all over the state and the greater Midwest, actually, who would travel to our Western healthcare facility for care at the end of life, and not being able to honor the rich traditions and rituals that they held so dear is what disturbed me so much to my core, that it inspired me to come back and do a PhD. And so I'm excited to get to learn from these communities that my learning is not 10 years long. It's, I think, going on 2. So I'm still a rookie, but getting to learn about what we can do to better support the capacity and what's already happening on the land, and so that people can be with their people and be comfortable and be where they want to be, is the ultimate goal. And I'm just really grateful to be part of that work. Adrian, over to you.
All right. So I don't know how many people we have on, but if you have any questions, now would be the time to ask. And if not, I think we'll close just a little bit early. As we're waiting for any questions from the audience or comments, do any of you have any closing sentiments or things that we didn't cover that we missed? All right. Okay, so what we'll do is everyone will go around. We'll do this again one last time, popcorn style, before we get to our closing. And I'd like you all to say one thing you'd like everyone to take away. And we will start with Dr. Brockie.
What I would like you to take away is the importance of doing research with Native communities, but also the rewards and the blessings that are returned twicefold for the work that is invested in these communities. Thank you. Katie?
I would like everyone to take away from this discussion that, their Native communities across the United States and beyond, they are here, they are not invisible, and we all collectively need to work to amplify the voices of everybody, because they are amazing people, and I'll leave it at that. And I'll pass it to Ellie.
What I'd like everyone to take away is, I think, the thing that I've learned over and over and find so important in doing research at Fort Peck and Fort Belknap is the importance of listening and standing back and making sure that you understand what the community needs and the community approach before moving forward. I think we forget to listen sometimes, and that's so important to this work and all community-based participatory research. I'll go to Debbie.
Well, unfortunately, I was going to say the same thing about the power of listening. That I think often as researchers and people going to research intensive universities, we're so busy focusing on learning and what we know, but being willing not to know and to listen allows the voice of something to brush alongside your ear. And when Teresa spoke about the vision, I mean, in 10 years, your vision is coming into a reality, and it's like sparks visions in others. And I think when you listen, you can get in touch with that kind of vision. And that's bigger than you. And also, therefore, it will live longer than you, which is a sacred thing. Adrian.
All right. What I want you all to take away is, if you are a researcher who's aspiring to work in Indigenous communities, or you are working in Indigenous communities, I implore that you use your positionality to enhance and empower the communities in which you serve, that you do everything with a good intention, with a good heart, and that you allow that good heart to guide every single step of the way. Because if you go in that respect, everything you do will be blessed by Creator, and you'll get better reciprocity inside the community that you serve, because we can recognize that. We can recognize intent in people. And so always check yourself. And like I said, use your intention, use your positionality for the benefit of the people in which you serve. And then if there are any community members, any Indigenous people watching, just feel empowered and know that you know your community best, and that you don't need any acronyms to be able to have a seat at the table, that your voice is valued and you are worthy to be at those tables to help be an advocate for health in your community. So, and we're so thankful, like without the communities, there is no work. So I just want to empower each and every person, Indigenous person inside those communities, that your voice matters no matter what. So, all right. So in saying that, this has been such an insightful discussion. I'm so appreciative of sharing space with each and every one of these ladies. We're excited about the work being done with through the Johns Hopkins School of Nursing in partnership with the Fort Peck, Assiniboine and Sioux Nation in Northeast Montana, and the Fort Belknap, Ani and Dakota Nation, located just 2.5 hours west of us in Montana. This is a great way to kick off Native American Heritage Month. So we thank you for this opportunity to share. All right. And then I believe we're good. So as we say here, Doksha Ake Pirame Ayapi.